All right, we are recording. Welcome everyone to the Maine State Breastfeeding Coalition annual meeting. Our plan for today is to start with a year-to-date update that will take about 40 minutes. And then we will spend the bulk of the rest of the meeting doing our connecting the dots, new knowledge worth having, and community discussion. So at the end of the PowerPoint, we're going to share our latest strategic plan draft. And this is we're really looking forward to hearing your feedback on that. So that community discussion will hopefully also include what you really like about the strategic plan, what you would like to see added or changed, and we will still be taking some feedback. So be thinking about that as we go along. And then we'll wrap up toward the end, sharing what we have coming up with future meetings, for instance. All right. Again, having to move some things around on my screen so I can see everything. All right. So first, I would like to acknowledge that here in Freeport, where I am standing, I am on Wabanaki, Abenaki, and Aroostooktuk land. And if you are interested in learning more about the Indigenous territory that you may be standing on, you can check out that website, native-land.ca. If you haven't already seen that, it's a really neat site to play around with. You can see on the map, you can basically see the main outline there and just how many tribal lands and territories we are standing on now. And it's nice to be able to recognize that. And next, we as a coalition board want to honor and recognize those who have been affected by hate violence in the past weeks, months, and years throughout our country and in our very own state of Maine. The number of stories of violence against Black, Indigenous, and people of color, in addition to those who identify as anything but cisgender, non-disabled, physically or mentally, or upper class or highly educated, have been highly astounding, disturbing, and disheartening. Oppression and acts of violence or microaggressions occur throughout Maine as well, all around us, not just on the news, which may be where you see it happening most often. It's really happening all around us. So families you work with and some of us on this call have been victims of prejudiced behavior, and they deserve our time and effort to recognize this and to learn more about these issues. And there are several resources we'd like to share where you can learn more about these issues. This is absolutely not a comprehensive list. If you know of others that you would like to share, please do in the chat box or by emailing us at mainebreastfeeds@gmail.com. And I will also be sharing in the second part of the meeting that Connecting the Dots document that has resources in there that you can take home with you, and you can also add things to that document. It's a document that's shared in a way that you can also add to it. So that will be shared later on, and you can share your resources in that as well. So who are we? If this is your first Maine State Breastfeeding Coalition meeting, this is our vision and our mission. Our vision is that when every baby receives human milk, we will be a healthier Maine. And our mission is that the MSBC is a welcoming and broad network of people supporting families who value human milk and breastfeeding. Together, we work to enhance the culture of breastfeeding around the state through professional networking, advocacy, and education. So the coalition has been around in various forms for many years, but we became established as a 501c3 back in 2017 and have grown quite a bit since then. And we also have a board of 9 incredible leaders. We'll share some updates on our board later as well. So one way we are building awareness and engagement is through bi-monthly meetings. And our annual meeting last year was our first fully virtual meeting, thanks to COVID. And since then, we've continued to meet virtually every other month from 1 to 3 p.m. And the only thing that changes on the agendas are the presentation and speaker. The topics we've had the past 12 months are trauma-informed care. Dory Hacker spoke about that. We had a wonderful panel last August during World Breastfeeding Week, speaking about cultural and family beliefs about breastfeeding. We had Petra Cord and Neelan Campbell speak about inclusive language and breastfeeding support. We had Malika Ludman speak about infant feeding and emergencies. She called in from New Orleans. And we also had Ginger and Samantha speak about the State of Maine WIC program in our last meeting in February. And we also always have a board update at the beginning of the meeting and then spend the last hour of the meeting connecting the dots, as I mentioned before. And these are the questions that prompt our conversations. So it's an opportunity to share what's happening legislatively, what's going on in Maine that's worth knowing about, what new research ideas are emerging, and what challenges people are having in their work that other participants could help with. So this is one of the best parts of the meeting, I think. So our average meeting attendance in this past year was 23. I think that's thanks in part to everyone becoming more familiar with that virtual format, and it's a lot easier to join in from around the state virtually. And back in 2018, for comparison, we had an average of 15 people. And at our last meeting, we had 33 people on the call, and I see we have 31 right now. So this is really exciting to see our audience increase during these meetings. We don't have an official membership, but stay tuned as this may evolve. In the meantime, we stay in touch with people who are interested through email. And we have 370 email subscribers, which in the past 2 years has increased by 110 people. And we have a social media presence. So that's grown quite a bit as well. On Facebook, we have 760 page likes. That has increased in the last 2 years. It's increased to 269 people. And Instagram has also grown quite a bit as well. Twitter, you may remember this presentation last year. I think we had 1 or 2 people on Twitter. Now we have 7. We're not active on Twitter right now, and we still have our little help wanted Twitter tweet bird there. So if anyone has a special interest in social media, we'll be talking more about what we can be doing to increase our social media presence. Okay. And we want to remind you about our website, mainebreastfeeds.org. And we have COVID-19 and breastfeeding resources as one example of a resource on that website. And speaking of our website, we want to thank Robin Snyder Drummond for her help making some updates to our site. And I'm also going to take a minute here to make sure no one else is in the waiting room. Okay. I'm not sure if I saw Robin come in or not. So Robin, if you're here, thank you so much for helping with our website. We're also going to be submitting an RFP, or a request for proposal, for web designers to help revamp and make some more significant updates to our website. And if you know of a designer who might be interested, who also might have an interest in lactation, then please send us an email at mainebreastfeeds@gmail.com. And that would be the ideal candidate if possible. Okay. And we also utilize our email list to send out information like advocacy updates, new resources, as well as event and meeting updates. And if you're not already receiving these emails, if you didn't receive one with information about today's meeting, then please go ahead and put your email in the chat box, and Amanda will take that down, and we will add you to our email list. All right. And Brooke, you are here, right?
I'm here.
Thank you. Brooke Barron is one of our board members, and she is going to, if you could introduce yourself actually, and then present the next few slides. Let me know when you want to hit next, and I'll do that.
Absolutely. Awesome. Like Kara said, I'm Brooke Barron, and I'm proud to be a board member of the coalition. I'm also a senior policy advisor in the Maine State Legislature, although I should note that I'm presenting here in my capacity as a board member, not as part of my day job. So there have been a few bills that the Maine State Breastfeeding Coalition has been involved with this year, this legislative session. And the first, LD 85, that's up on the screen there. This bill would require Maine DHHS to reimburse the cost of donor breast milk for any infant on Maine care. So those are infants in low-income families who have certain medical conditions that would make them good candidates for donor human milk. And we're really excited about that bill. It really removes cost as a barrier for low-income families that want to provide human milk to their babies but aren't able to. So that bill, I believe it was in late February, had its vote in, or maybe early March, in the Health and Human Services Committee of the legislature. It was supported unanimously, and we really appreciate those of you who testified in favor of that bill. So all Democrats and Republicans in the committee supported it. And just earlier this week, on Tuesday, the full House and Senate voted on it. Again, it had unanimous support. It's still moving through the process. All bills in the Maine state legislature have to be voted on twice by both the House and the Senate, first an engrossment vote and then an enactment vote. So all this is to say that it's a long process, but this bill's moving through it. The legislature won't have full votes again until April 28th, but we expect it to have its final vote in the House that day. And after that, it will be sent somewhere called the appropriations table, which is where all of the leftover money from the budget is divvied up to all the worthy and sometimes not so worthy pieces of legislation. So that will be a really wonderful opportunity for all of you and the groups that you're involved with to reach out to your legislators and let them know that this is an important bill to fund, and let them know why this should be a priority for the funding that will be divvied up. And then another bill that the Breastfeeding Coalition has been involved with is a paid family medical leave. You'll notice there it doesn't have a bill number yet, and that's because the language is still being drafted. So about half of the bills that were introduced this year in the legislature have officially been released with full language and a bill number, and they just haven't quite gotten to this one yet. So it's going to be a study looking at a working group looking at the feasibility of paid family leave in Maine, which we all know is so important and will be crucial. And we'll definitely keep you updated through the newsletter and future meetings. So please be on the lookout. Once there is a bill number, then there'll be a hearing, and it'd be wonderful to have folks testify on that bill. Kara, anything? I know you've been involved with this. Kara, anything you want to add?
Yeah, I'll speak to that a little bit more later, actually.
Great.
Yeah, but I can move on to the next one, the next slide for you.
Great. And this bill, another one I wanted to mention, LD 265, really exciting bill to expand access to postpartum health care. So this bill says that for people after giving birth, currently, if you're quite low income, you qualify for Maine care. But if you're low income but not quite low income enough to qualify, you are automatically eligible to be in Maine care for 60 days after giving birth. So, that's an important provision. Obviously, there are immediate health needs that new parents have after giving birth. But I think we all know that 60 days is nowhere near long enough. So this bill would expand that eligibility for low-income families to a whole year after giving birth. And a similar bill was introduced last year and was moving through the process, but got caught up when the legislature adjourned early because of COVID. So it was exciting to have it come back. But the really great news is that as part of the American Rescue Plan that President Biden signed into law a couple weeks ago, there was actually a provision to make it easier for states to do this expansion. So eliminated some of the procedural challenges to making it happen, and also will fund it at the Medicaid reimbursement rate. So it will pay for 75% of these costs. So that's really wonderful. It makes it a lot more affordable for Maine. I believe the estimated impact is that this will impact about 250 new parents in Maine each year. which is really, might sound small, but actually makes a huge difference. That's 250 new parents who are getting accessible, free coverage, healthcare coverage that weren't otherwise. So initially it was all the Democrats supported the bill and all the Republicans opposed. And then about a week later, the Republicans had a change of heart and asked the bill to be reconsidered. So it's now unanimous. It's no longer partisan, which is wonderful because this should not be a partisan issue. And the next step for this bill will be headed to the full House and Senate for a vote. And again, the earliest that would be April 28th. So we'll keep you posted, and always wonderful to have folks testifying and speaking in support. I think one silver lining for COVID is that the legislature had to enter the 21st century. Before this year, we didn't have ways to testify online or over the phone. And I think this has really opened up opportunities for people to weigh in who can't get to Augusta because it's far away, because they work, because they have responsibilities. So I hope that you all take that opportunity to weigh in. Kelly, do you have a question?
So a curiosity question, what change, was it because of the American Rescue Plan that the Republicans changed their mind, or what changed?
That's a good question. What they said was that the original time the bill was voted on, there was some procedural sort of gymnastics that they didn't agree with, and they wanted more time to consider. And the Democrats just, wanted to move the bill through the process. So, but it is, I think probably that the rescue plan played a role because it did pass in between the first vote and when it was reconsidered. So I'm sure it helped. And if anyone has any other questions, feel free to ask.
Okay, great, Brooke. And there's one more slide. I don't know if you wanted to share about that or if you want me to speak to it.
Yeah, Kara, you worked on this. Why don't you talk about that one?
Sure. Thank you so much, Brooke. So this is a document that was included in our last newsletter, and this is a COVID-19 workplace rights, breastfeeding and lactation related that the United States Breastfeeding Committee and Work-Life Law had worked on with us, and they essentially created one of these for each state, and each state that had a breastfeeding coalition that wanted to work with them on. If you aren't on our email list, then please let us know. We'll add you to it. A link to this too will also be in that document that I'll share toward, in the next part of the meeting. So stay tuned for that. And Amanda, you are up next for this part here.
So the Maine CDC, Dawn Littlefield, who's the obesity prevention coordinator, along with a student intern, asked the Maine State Breastfeeding Coalition to create a breastfeeding policy for workplaces that are using this Healthy Us scorecard. I always want to say US, but I think it's Us scorecard. Next slide, Kara. So this is a website that worksites can go into to get tips on improving the health of their job environment. So they have things like tobacco control, heart safety, physical activity, and we're under healthy eating. Next slide, Kara. So we created these. There's one more. There's good, better, best. So if a workplace wanted to improve their breastfeeding support, they could follow these suggestions. And with the lowest ones, we started like things the law requires. So, a private place with a lock would be nice. And then for the next levels, we said things like provide a hospital grade pump on site, have snacks, etc. So just kind of, increasing how those lactation places look in the workplace. And we hope that this tool really gives work sites an idea of how to support their lactating employees, because as we all know, that can be a barrier for a lot of people.
Awesome. Thank you, Amanda. All right, and World Breastfeeding Week 2020. We had a great week of webinars and celebrations. There were 179 total registrations for the week's events, and we raised somewhere around $2,500, give or take a bit, through sponsorships and some ticket sales. So that was a great opportunity to do that since our normal fundraising events weren't able to happen. So it was nice to have a great team of planners for these events and speakers as well. The Zoom format worked really well. We're looking forward to this year's World Breastfeeding Week. If you're interested in helping us plan something, please let us know. I think I'd mentioned that in the last email newsletter as well, that we are just forming our World Breastfeeding Week planning team now, and we will be meeting in a couple of weeks, I believe, to start that process. So let us know if you are interested in being involved in that. And this is a community slideshow that I want to play for us all. Hopefully this will play. It's 4 minutes long, and if you missed it last year, it's just a really special video to show how we celebrated the end of World Breastfeeding Week. So that is still, all of those stories are hugely valuable. We're big supporters and believers of storytelling. So that was a really fun project. Thank you, Amy Van Haren, for putting that all together. We look forward to doing something again like that next year or this year. So some other collaboration efforts that we have been a part of. I want to share something that I worked with Maine Health's Let's Go program last summer in creating a guide for early care and education programs. This can be found on our website. It's also on the Let's Go website. It's about 38 minutes long, and something that if you work with early child educators, then please share that with them. It talks about, how to properly store and handle breast milk and how you can create a welcoming and supportive environment for families, and essentially educating providers on how to build confidence in supporting moms who breastfeed as well. Amy and I worked together on this pandemic webinar as well, how to work and breastfeed and get through a pandemic, along with Paige in New York. And this was a really great opportunity. This is available on the Pump Spotting website. I don't think it's live on our website yet, but we talked about working from home and the stress and potential impact that might have on milk supply, talked about keeping milk safe and pumping spaces clean. I'm just excited to work with Amy on the part of our strategic plan in particular that is about workplaces that she'll be speaking to later as well. I'm also part of this Healthcare Coalition of Maine committee specific to access and functional needs. And the goals of this committee are to identify access and functional needs of our state, helping partners and organizations plan for those with access and functional needs, and identifying resources and identifying gaps that need to be filled. So this meets quarterly, and if this looks like something you would be interested in participating in, please let me know. You can be an additional person to represent pregnant, postpartum, and lactating women and what kinds of needs they might have. Let me know if you're interested in that. And then the Paid Leave Coalition of Maine. So this group meets every other week and is currently focused on community engagement and business outreach, as well as learning and sharing what has worked in other states and being prepared to help support the legislative process when the time finally comes up. Like Brooke was saying, it's still not released yet, but once it is, and there have been different versions every year, but we are excited to help support the version that comes through this year. And you may have seen the communication blast in March this past month about, they called it the March for Paid Leave. So there were a lot of different reasons for why it's important to support paid leave, including breastfeeding. All right, so Sarah Gabrielson is going to present our financial update. Are you available, Sarah?
Yeah.
Great, thank you.
Hi, everybody. Yeah, so this last year, oops, oh, I'm sorry, 1 second.
Okay. So we will also be speaking about, go ahead, Sarah.
I apologize, I'm sorry. My son has a fever, so he calls me from upstairs.
Yeah.
Okay. He doesn't have COVID that we know of, but sorry about that. So I'm just, yeah, I'm happy to, I'm happy to present the last year of revenues and expenses for the Maine State Breastfeeding Coalition. So it was a different year than previous years because our biggest fundraising event was the World Breastfeeding Week sponsorship and private contributions this year. In previous years, we've had other fundraising events like benefit nights. Flatbread UC did offer us a benefit night this year, but in past years, we've participated more in it and even had it on Mother's Day. They've been very generous for many years. But this year was a little bit different. So as you see, we also have transferred some PayPal account money. So that wasn't really earned in this year, but it's reflected in our revenues. But overall, we had almost $5,000 worth of money into the account. And then in terms of expenses, we had about $400 of kind of every year expected annual operating expenses. We have them, we operate on a shoestring, and so that's what we do. And then we also gave gifts to some of the presenters for World Breastfeeding Week and some outgoing board members. We are members of Maine Association of Nonprofits, and some board members attended a training this year. In past years, expenses have included participating in the national, Kara, help me out here. The
United States Breastfeeding Committee.
United States
Yeah.
Breastfeeding Committee, which was a wonderful event. And hopefully in future years, that'll be possible for board members. So overall, we had a change in assets of almost $4,000 up to almost $7,000 as of this month. So we have the ability to fund things like website updates and other exciting initiatives, which it's a great time to be, to have a little extra money to do some upgrades. So,
yeah. Sarah and I were just reminiscing about how, Kelly, I think you may have been there as well. Maybe 6 or 7 years ago, those of us who were on the steering committee had to chip in, I don't remember how much, $10, $20, something like that, to pay for the website at the time.
Yeah.
Because we didn't have any money. And so this is really exciting to see some progress. And now we have to figure out, okay, how are we going to use that? And that's where the strategic plan comes in that we'll be sharing. Thank you so much, Sarah. So speaking of Sarah, we do have some changes to our board of directors, and Sarah is her term has ended and she's going to be transitioning off from the board. So we want to start by thanking Sarah for being such an integral part of our board of directors for the last 3 years and part of the steering committee for many years before the board was officially created. Sarah is a registered nurse and completed a Master of Public Health degree at the Muskie School of Public Service at the University of Southern Maine, 2019. And she currently works as the research navigator for pediatrics at Maine Medical Center. Sarah is proud to be raising 2 beautiful, creative, and kind boys. I can attest to those aspects of her boys. And she has been part of the MSBC for at least 8 years and has been the treasurer for the past 3. She has helped set up our financial system and sent in that initial application for the 501c3 status, which was no small task. So seeing her leave the board is not easy, but I know that this will allow more time with her family and to focus on her incredible pediatric research work at Maine Med, some of which has a lactation focus, I believe. And Sarah's also interested in staying involved, so we know this isn't a true goodbye, but we want to say thank you very much. And Donna, also, we want to thank Donna Ellis for serving on our board for the past 3 years. Donna began her nursing career as an Army Nurse Corps lieutenant. She served as the U.S. military families in Germany for 30+ years. And soon after she moved to Maine, about 7 or 8 years ago, she reached out to the Maine State Breastfeeding Coalition and has been increasingly involved ever since. She most recently served as our fearless secretary. Again, no small task there. That's not a small role at all. She set up our system of taking minutes as well as reviewing and approving them as a board. And that is a huge task that we've all been so appreciative of. So she is now moving on to become a master gardener. And we have sent her our best wishes along the way. She wasn't able to make it today, but we have thanked her. And so with 2 outgoing board members, we are excited to announce, hot off the press, 2 new board members. First, I'd like to welcome Petrichor or Trix Nealon Campbell. Petrichor, whose pronouns are they and them, is a La Leche League leader in Bangor, Maine, and has been helping parents with human milk feeding questions since 2018. Currently, they sit on the La Leche League USA Council. With equity, diversity, and inclusion being their passion, they helped to found the Equity, Diversity, and Inclusion Committee in the La Leche League, Maine, New Hampshire La Leche League, and also currently serves on La Leche League USA EDI Committee. As a person within the LGBTQIA+ and disabled communities, they strive to make the world of birthing human milk feeding, and parenting a more inclusive space. When Petrichor isn't doing La Leche League work, they can be found exploring the outdoors with their spouse and 5 kids, running their own business, reading, creating art in various forms, and gaming. I first heard Trix speak at La Leche League of Maine and New Hampshire conference several years ago and knew they were someone we needed to connect with and learn from. And I'm so glad that they are now going to be part of our leadership team. So welcome, Trix. And Trix is here. I saw her. So if you want to wave, if people can see you.
I'm happy to be here. I'm excited for the opportunity.
Yay, thank you. And we are also excited to welcome Amy Page to the board. Amy has spent over a decade working in healthcare with undergraduate and graduate degrees in economics. Her passion for solutions founded in data and driven by empathy led her to her current role at Ovia Health, the largest women's and family health benefit in the country. Amy has dedicated to sparking change at the community level and has served in roles in town politics, local search and rescue, as a yoga teacher, and moderating online national forums focused on breastfeeding and baby-led weaning. After 3 years of nursing her 2 children, Amy's final breastfeeding journey was cut short by a cancer diagnosis in 2020. Now cancer-free, Amy's commitment to helping other families meet their breastfeeding goals has brought her to the MSBC, where she hopes her experience in family building, health tech, and her personal story can benefit Maine families. So welcome, Amy. We are so glad you are here too. I think you are here as well. I can't see anyone right now based on my screen. So if you want to wave to whoever can see you, please do. And maybe we can hear more from you in the next part of the meeting as well.
I'm here. Thanks for having me.
Hi. All right. So next up, we have our strategic plan. We've been grateful to have help from Carol Kelly and our strategic planning process and have come a long way in the past year. She gave us some guidance starting with this flow sheet here. So we had an idea of what direction to go in, where to focus our thoughts. And here is one aspect to it. So we're going to be sharing each part here there will be 4 of us sharing, 4 of us who have been working especially hard on this in the last months. So we have our vision and our mission, and then we have our core functions, our connect, support and educate, advocate, and sustain. And under connect, our goals are to deepen the community engagement in Maine State Breastfeeding Coalition by providing opportunities for connection, networking, and partnerships among a diverse range of stakeholders. Our support and educate goals to provide and promote breast and chest feeding educational opportunities and resources, and to optimize workplaces in Maine and empower employers to create supportive cultures for breastfeeding employees. Under advocate, we have that we hope to promote legislation that will allow more Maine families to achieve their breast milk feeding goals through access to paid and family medical leave, workplace support, lactation care, postpartum health care, donor breast milk, and other systems and policies that facilitate human milk feeding. And then last but not least, sustain, which is to ensure the long-term sustainability and efficacy of the Maine State Breastfeeding Coalition. So this connect goal, we have objectives and strategies under each of our goals. And the first objective for deepening community engagement is to increase the number of individuals and organizations consistently attending our meetings and events by 10% each year. Our strategies to do that would be to first create a membership survey to determine the current makeup of our audience, to enact a communication plan to increase the reach and deepen the engagement between our meetings, and to continue to host our networking and educational opportunities through our meetings, webinars, events, and other special events. Excuse me. And then our second objective is to each year increase the participation among underrepresented and underserved groups, including BIPOC, LGBTQIA+, low-income individuals, and geographical area within our board and within our meeting and event participants, our guest speakers, and other event partners. We hope to do that by expanding geographical representation. So each county is represented at our meetings by 5 years. This is a 5-year plan. We want to develop and share a DEI policy by the end of 2021 this year, as soon as possible, really. establish a fund or a scholarship for CLC trainings and opportunities for Black, Indigenous, and people of color, and fill our open board seats with members from underrepresented groups. I know this is a lot of information, so take your notes, think about your questions that you have as we go through it. And this presentation will also be saved, will be shared as a Google Doc in that Connecting the Dots document that I'll share after if you want to look back at it. And this is also not final. So we want your feedback, if I didn't already say that. We want feedback from our new board members as well, who are just seeing this for the first time. So like I said, we're definitely looking forward to that. And Nicole Hart, are you there? Are you ready to present this slide here?
Yes, I am here. Okay, so did you already say support? No, okay. So another goal relating to support and educate is to provide and promote breast and chest feeding educational opportunities and resources. So our first objective supporting this goal is to increase traffic to our website and also the number of educational resources living on our website. And so a strategy to work towards that objective is to enhance our website and resource library. So we are, as Kara mentioned earlier, releasing a request for proposals for a designer to help us make some improvements to our website, and we'll also be actively building a resource library between now and the end of 2022. I expect this will be something that's an ongoing thing. A second objective is to include opportunities for lactation professionals to expand their skill set and knowledge in 3/4 of our coalition meetings. So this is really continuing what we are already using our coalition meetings for, and we really wanted to flag that. So supporting this, we will continue offering educational presentations at our bi-monthly coalition meetings. As Kara mentioned, we also plan to offer scholarships for professionals to attend lactation trainings, and we specifically have Black, Indigenous, and people of color in mind. And also we plan to collaborate with partners to provide trainings or share their own educational opportunities related to breast and chest feeding. So we'll continue to do all of these things well. Our last objective here is to promote breast and chest feeding educational opportunities and resources through monthly communication pathways. So to do that, we will be developing a communication plan, including monthly email newsletters, our bi-monthly meetings, and our social media messaging. So more details on all of that to come, but having a cohesive kind of forward-looking communication plan will help us do this in an intentional way.
Excellent, thank you, Nicole. And we will move on to Amy presenting this slide.
Great. Hi, everyone. So the second bucket for our support and educate goal is to optimize workplaces in Maine and to help empower employers to create supportive cultures for breastfeeding, chest feeding employees. And this couldn't come at a better time, as probably many of us are aware, so many women are leaving the workforce due to COVID and so much that's going on. So this feels like a very important initiative for all of us. So the first objective is to develop a downloadable best practices workplace toolkit and to launch that by the end of the year. And so to do that, we are going to curate or create key elements of our own workplace toolkit and put together resources that organizations can download and then adapt so it works for them. Then we'll drive downloads of the workplace toolkit through outreach to key leaders within Maine companies and partnerships with organizations like the Maine Chamber of Commerce, who can help the toolkit get into more employer hands throughout the state. And then we'll develop a downloadable one-pager with resources for parents who are breastfeeding and going back to work. So we really help make it easy for employers and for parents to get access to resources and start to drive change. And then the second objective is to release a breastfeeding friendly workplace designation the following year by closer to the end of 2022. So we'll start by researching current models of breastfeeding friendly workplace designation programs that are already happening in other states to see what's working and what we might mirror or build off of. We'll promote positive workplace efforts through our social channels and really champion and applaud those who are making changes and doing things well to inspire others. We'll look to recruit 5 leading companies in Maine to help them earn the first breastfeeding friendly adoption. And then we will host a breastfeeding friendly workplaces kickoff event to honor those companies. So it's really twofold. It's really helping to build this designation in a way that honors all the proactive things we want to happen in a company, and then to build out kind of a marketing and promotional initiative to help celebrate, encourage, foster, and get more companies on board. And then the last objective here is to increase the number of recognized breastfeeding friendly workplaces by 10% each year starting in 2023. So once we've built the toolkit and the resources and then the designation, our goal will just be to continue to actively encourage employers in the state to join. And we'll do that by creating and distributing a workplace survey. So we can first assess what companies are doing throughout the state to see where we are and what we need to improve. We can repeat the survey each year to see how we're growing and how many employers are making positive change. And then we'll continue to follow and support any policies or legislation that helps expand and deepen support.
Awesome. Thank you, Amy. All right, Brooke, are you available? I know you said you had to call in again on your phone. Can you see this? Are you there, Brooke?
Hi.
Oh no, it's echoing.
Yes, I can hear. I'm gonna keep my video off. Hopefully my internet will stay stable.
Okay.
Yes, so the next goal was around advocacy. And can you guys hear me okay? Great. So I can just walk through this. The goal is to promote legislation that will allow more Maine families to achieve their breast milk feeding goals through access to paid family leave, medical leave, workplace support, lactation care, postpartum health care, donor breast milk, and other systems and policies that facilitate feeding human milk. And as you can see, we have 3 objectives listed out here. So objective A, advocate for one policy or legislative initiative each year that enables more Maine parents to achieve their breast milk feeding goals, and strategic initiatives to get us there include, should I go through all of these, Kara? Is that helpful?
Yeah, it's skimming through. A
Sure.
lot.
So reviewing legislation that's introduced that fits into our vision and advocacy goal, or that would be detrimental to our goals, keeping track and organized with all of those. Also drafting criteria to set priorities based on impact of policy, also ease of passage, and including an equity lens, prioritizing legislation that supports Maine's BIPOC, queer, and traditionally underserved communities. Looking at other states, other towns that have legislation that we might be able to replicate, and also leaning on the U.S. Breastfeeding Committee. USBC committee, yes, which is a great national nonprofit. So leaning on them for federal level advocacy opportunities. The next bucket, the objective is increasing the number of MSBC board members who express strong confidence in their advocacy skills. So doing that through trainings and working on building up personal toolkits so that folks on the board feel comfortable and familiar with the legislative process. And then third, forming an advocacy committee to establish relationships with key legislators and staff by 2022. So assigning one board member to be the liaison with the Maine Women's Lobby, which is a really great organization And they have wonderful newsletters and online resources that really break down how to get involved, how to testify, how to submit testimony. So just as a side note, certainly recommend everyone here checking out their website. And then also looking for municipal city level opportunities. So whether that's in Portland, Lewiston, Bangor, looking for opportunities to influence good policy on the local level. And then again, building those relationships with legislators and staff, educating them about the value of human milk and the need for policy change, just so that they have a base level awareness before a bill comes up, so that when there's a bill that we need their vote on, we already have a relationship established there.
Awesome. Thank you, Brooke. All right, and our last one, Amanda, you're up.
Right, so last goal, but definitely not least, is to sustain the Maine State Breastfeeding Coalition for the long term and to make sure it's effective in our mission. So the first objective is to provide twice a year educational opportunities for board members. So these would be trainings like grant writing, fundraising, equity, etc. The next objective is to hire a paid executive director by 2022. For as long as we've been around, all the positions have been voluntary, and it would be really great to have the ability and the funds to hire paid staff to continue our mission. And then C, the objective is to increase financial sustainability, which includes applying for grants, building donor relationships. And we're also looking into paid membership models, which some other breastfeeding coalitions do. The New Hampshire one does it, right? Is that correct, Kara?
Yes.
So yeah, we're looking into that model. And then the objective D is to do an annual assessment, which includes a board assessment tool and an email survey to our email list. And the last objective is to continue recruiting people to be on the board. Our terms are 2 or 3 years, which can be renewed 4 times, but we often have openings every couple of years. So we want to make sure we're filling those and adding a board application to our website. So thank you to everyone on the board for their efforts on this. It's been a long time coming. And again, thanks to Carol Kelly for the consulting support with it. And to Amy Van Haren for making it look beautiful. I really appreciate your formatting.
I love the color.
Yeah, so it's so nice to have that all together. So we wanted to invite people to share their thoughts or any questions they have on any of our goals, objectives. This isn't, fully final. We're happy to take any comments that you have. So if you have any right now, you can let us know. You can put it in the chat. You can email us.
And I think we'll move into the more participatory part of the meeting here, where you can be sharing your voice. So we'll move into connecting the dots. And what I'm going to do is I have to exit out of this here so that I can copy and paste that. I'm going to stop sharing my screen for a second. And then this way we can also see each other a little bit better. So this is a great time, if you're up for it, to have your camera on so we can really feel like we're in the same room, like we would if we were in the same room. So if you are up for that, that would be really great. This is the document that you can click on. And in that document is a link to the PowerPoint presentation. If you want to look back at those slides about the strategic plan, if you have any questions specific to those. And then I'll also put in the questions, the connecting the dot questions into this. Oh, sorry, that went just to one person. So hold on a second. This gets tricky when. There you go. Now you can all see that. And then the connecting the dots questions. This is also a great opportunity to just stretch for a minute and grab something to eat or drink if you need to. And we have another hour to be connecting and chatting. So I'm going to put those connecting the dots questions into the chat box for you to see and think about what you might want to chat about. And Amanda, are you up for facilitating this part of the meeting?
Yeah.
Okay.
I just need to let me get the slide back in my view. So this is in the chat, but just, you know, what ways you're excited to see us support, what, you know, if you have any ideas for us to work on things, if there's anything going on in Maine or at your work that you would like to talk about or your challenges. Legislatively, if there's anything that you know about, any new research. So really open floor to discuss. And when you first talk, if you can just introduce yourself, you know, just name, where you work, whatever you would like to share in that area. Who's gonna break the ice?
I'll break the ice, Amanda.
Hey.
This is Sarah Gabriel.
Right, who are you? Who are you, Sarah? Yes.
I'm Sarah Gabrielson, outgoing board member and research navigator for Barbara Bush Children's Hospital. And something that I'm excited about that one of our other board members and people here, I believe today, is also working on is a quality improvement project that a nurse manager at one of the Maine Medical Partners pediatric offices brought up to a group of us. And she just brought up this concern that she really wants to improve the breastfeeding support for her office, but also spread it throughout Maine Health's pediatric offices and anyone who sees parents of newborns and older children. So one thing we're looking at the current moment is we're trying to figure out how we measure newborn feeding in the outpatient setting through our electronic medical record, and the kind of questions that are asked of parents about how they're feeding, and also how that's measured on the inpatient setting when people deliver at Maine Medical Center. So we're looking at how the electronic medical record keeps all that data, and then trying to figure out how we can kind of improve the way so that we can measure progress over time, improve the way that's recorded. So I think the plan would be to pilot any changes that would need to be made about how to record newborn feeding at one Maine Medical Partners pediatric office, and then have that spread like wildfire. And I'm just very pleased we have some really supportive people of this whole process, including people from Let's Go. And it's very heartening. And I think there's so much that can be done with this project. Even after we start measuring things in a really good way, then we can start making improvements and see if, you know, that affects how people feed their children. So it's very exciting.
Thank you for sharing. If anybody has any questions about that, they can respond, or if you have anything else that you want to talk about.
I'll go next. So I'm Mariana Flord. I am from the Bangor WIC agency. I'm the breastfeeding coordinator here. So just a couple of things I wanted to share. We just started doing what we call a mini series with our breastfeeding peer counselor, Mitchell. The way we kind of wanted to approach this was to create short educational videos around breastfeeding. to kind of capture people's attention for certain topics in a short amount of time. With everything being virtual and everything, we figured this would be a good outlet to get education out. So we just started that this week. A few topics that we have. So she just did one on how families can help, like how they can be involved, like how parents, or not parents, partners and siblings or other people of the family can be involved in mom's breastfeeding journey. She has a couple on breastfeeding myths, when everything goes wrong, and there's a whole list of them that she's going to start doing. So we post those on our social media pages, so Facebook, and then we're working on getting them on our Instagram page. If you want to follow us, we're Facebook is Bangor Public Health and Community Services, and then our Instagram is WIC Bangor, Maine. So we have those on there. We're also sending them to the state, and they might be posting them on, and I say state, I mean the WIC State Agency. So they might be posting them on their YouTube page at WIC State of Maine. And then, so that's one thing that we're doing here at Bangor. And then I also had a question to see if I could get any guidance on it, just to see if you guys have had this experience before. But we noticed that one of our healthcare providers, OBGYN offices, is promoting, they have a big display, and it's all formula, like how to get free formula, and which is fine, but there's nothing in that office that says anything about breastfeeding. And so I was wondering if anyone's come about this or have any advice on how we might be able to reach out to the community and not say anything about like the formula part, but just a way for us to get that promotion out for breastfeeding, to kind of just make it more present in the offices, since that is an OBGYN office. But other than that, that's all the updates that I had.
I so appreciate you bringing that up, Rihanna. I'm guessing you might not be the only person here who's been in a pediatric office or an OB office and kind of looked with that lens. And awesome, Gloria. I knew that someone here would have something. I think there might be a link coming here. I'm not sure, but there are breastfeeding friendly office checklists essentially in the pediatric setting and also the OB. I don't have the link of that I could quickly get now, but I can try to send that out and add it to this new knowledge worth having document when I get a chance. I'm going to make a note, and then if anyone else has anything like that, that's great. Do they have any like WIC documents or?
So we do provide them with like our posters of WIC and everything. So, I mean, I definitely want to dive into that more to kind of get more or just more better information with it. But I just know they post it on their Facebook too, of like, it's a big like letterboard on how to get free formula, and they have like giveaways and everything like that, which again is fine. But there's no like signs like what they're promoting, like the breastfeeding, and maybe it's just that healthcare provider, just that one. I don't know of any other ones in the area, but I just wanted to try to see if we could, send some things over to like help promote breastfeeding too.
So, hi, I'm Dr. Allie Kopelman. I'm a pediatrician, and I have been kind of in that healthcare setting for a long time. And my guess is they probably don't even realize that they're not supporting breastfeeding. So a lot of times if you simply call and just say, hey, I was seeing this and I was wondering if, and sometimes even starting with the office manager who controls everybody is like a good way to kind of creep in backwards.
Yeah, that's a really good idea, and I definitely will try to reach out to them and just inquire about it.
I just added a toolkit in the chat. This is something that the practice manager who I was just mentioning doing this big quality improvement project, she's been in contact with the people at the University of Vermont about, they created this improving breastfeeding supports in primary care settings. So I imagine some of it would, apply to an OB setting too. I think some of these links may not be working anymore, but I can definitely help you be in contact with the people who have worked on this page. I think they were in the process of making sure they were all working and live, but I'll put my email there too for you.
So thank you so much.
Oh,
Yeah.
Can I share something? Let me just see here. How do I do this? Share
Can
my
hear you,
screen.
Gloria.
Yeah. Well, if you could just hear my audio. I work in a hospital, and I've worked with the Baby Friendly Initiative for many years, not in this current hospital, but in another. And what tends to happen is the formula representative gets connected with somebody in the pediatric or OB offices, makes good friends with them, offers educational trainings. And then once they've made that connection, then they provide materials and free display and free materials and so forth for the office to put out there. So it's very hard once they've stuck their foot in the door to have the other folks in the office understand what a negative impact that is on breastfeeding, and how to navigate around that carefully but clearly. And the patient doesn't understand that this display is going to discourage their breastfeeding. And that's the unfortunate thing. But that is very typical. And, unless the agency, unless that OB office is connected with with a breastfeeding friendly goal in mind, or with a hospital that has a breastfeeding friendly goal in mind, it's going to be hard to change it. So that's been my experience.
Hi, Rihanna. My name is Abby. I'm new here. This is my first time, but I work for the Carolina Global Breastfeeding Institute and UNC Chapel Hill, even though I live in Scarborough now. But we actually have a lot of free downloadable tear sheets that I think a lot of times when you're looking at advertisements in the doctor's office, your eye is always drawn toward the one that's the most colorful, glossy, and so we've got some great free resources that either they could download themselves and have printed, but they're also translated into Spanish and Arabic. So that might help, them also meet some of their patient needs. I don't know what populations are served in that doctor's office, but I can put that in the chat. It might be a helpful resource too.
Yeah, thank you both so much.
Is it
All for those suggestions? Are there any more?
Yeah, if it's okay if I jump back in really quickly. This is kind of a peripheral question, but as I get started doing out like a private pediatric practice where I'm focusing on lactation, one of the things I've noticed in the community that is missing is the ability to treat bilirubin, to treat jaundice babies outpatient. It's been my experience that we always re-hospitalize these kids, and there's really good evidence that they don't need to be re-hospitalized. You can have a billy blanket that you can even keep nursing with at times. And it's probably easier and better for the mother infant dyad to stay in the comfort of their own home. So I guess what I'm wondering is, do you think there would be support in the community if I were to obtain a billy blanket or some form of home phototherapy system?
If I can share, a few years ago, the local DME providers had Billy blankets that they rented to families who needed one. And that went out probably, I'm going to say 5 or 8 years ago. And I'm not sure quite why, but the DME providers that have or had that equipment no longer provide it. And I'm not sure if it's because it's not covered by insurance or they're not returned. I'm really not sure about that, but it used to be a resource available. And in my area that I'm working, it's not available anymore.
Gloria,
So,
thank you for adding that. Hi, Gloria. It's so good to see you.
yeah, it's good to see you too.
Dr. Copeland, my name is Holly Mielkars. I don't think we have met. I'm an RN IBCLC, and I'm the director of education at Acceleron Medical. And so I would love to speak to you more on that because we are a DME that has been supporting Maine for many, many years with obtaining breast pumps through insurance and working with the state on getting milk storage bags approved. And so we have had a lot of, from our OB practices, a lot of questions regarding home blood pressure monitors, from the OB side of things. And I am really excited that we are now working with many of the New England states and providing that for OB practices because there was a demand for it. So from a pediatrician's perspective of things, I would love to speak to you more. And then especially, what Gloria has just validated, that might be something that Acceleron can, because we take all the insurance piece of it. So, myself, my director of operations, all the contracting and all of that, we can do all of that legwork. And Gloria, I can even probably find out what really kind of happened with that dissipation of the Billy blankets. But that is something that I know I have brought up in the past, but it never really went forward. But having a pediatrician, and if you and I maybe could chat a little bit more about it, and getting these into, the pediatrician's offices, family practice offices. I already support all those practices in Maine, so I would love to help you with that or to find that out if you think that as a pediatrician would be something that the state would benefit from.
Yes, very.
So does Kara have your information, Dr. Kopelman?
She does.
Okay, so Kara, maybe I can get that information from you and then we can touch base.
Sure. Dr. Kopelman, is your info in your name here too?
That's a really good question.
I'm getting computer savvy.
If you want to enter it in the chat, feel free. Otherwise, I can share it privately with Holly.
Okay, great. Thank you.
Yeah, your name says doc@mainpeds.com, so that's what it is.
Excellent.
Yep.
Oh, perfect. Thank you.
Great. That's exciting. A connection.
I miss you all so very much. So the more connections, the last connection I need is to be able to get back up in the state of Maine. I miss you all so much.
We miss you too, Holly. I'm so glad you're
thank
here. And Holly, I know you had something you wanted to share today too, right? Did you say you had something?
Yeah. Well, I just, I can keep it real quick because a lot of my folks know, especially my WIC friends. I just had a little quick in-service with them, I think last month it was, and just reiterating that, Acceleron is working really closely with Maine Care. Once again, they must be like, oh, here comes Acceleron again. But they have been so great. And now we are able to provide milk storage bags for all of your Maine Care patients. So how that will work, there's really 3 ways of going about that. One, we changed our order form, the breast pump order form that you guys are used to using. We have added blood pressure monitors, we've added milk storage bags, compression, and then hopefully Dr. Kopelman's Billy blankets could be added to that too. And so the providers can order them that way. We also have a separate form that I created for the inpatient lactation consultants. where if they are seeing a mother-baby return visit and the mom did not get the milk storage bags with the pump, they can go ahead and it's a whole separate form for the milk storage bag. So those are the two ways. And then the last way is that if the provider goes to aceleron.com, and in the upper right-hand part of the screen, if they click breast pumps and they scroll down, there's going to be an area that says milk storage bag program. And then the order form will pre-populate. And then any of the providers can order it online for mom as well. And the nice piece with this that we worked out with Main Care is that we are going to be able to provide the milk storage bags in months of 3. So there'll be 100 milk storage bags and per month. And then we'll be able to resend them out as needed. But it's nice because Aceleron will check in with the mom every 3 months to make sure that she's still breastfeeding expressing her milk. And we're really taking that piece with making sure the mom is enrolled with the WIC program. So that's a really great time for us, every 3 months to be referring the moms, as long as she's breastfeeding and pumping, or if she's like, I don't really know if I'm going to be pumping anymore. Our team really wants to make sure that that's a key time to be referring back to WIC and the support that WIC provides. So, and Main Care is allowing us to provide the milk storage bags up to 12 months. So we'll be in good contact with these moms and touch base with them. So it's really it's a great process too, that we can just touch base with these moms as, the trust, we get a lot of those calls. And so we're able to refer them back to their, home-based lactation consultant, private practice, or our WIC, peer counselors and breastfeeding coordinators and, everything that you guys are, doing up in the state of Maine. So I just wanted to just let you guys know that if you need anything, I know WIC is knows about it, but just wanted to make sure that I'm trying to get all of, it's just, you guys are such a big state that it's, trying to make sure that everybody is aware of all these, because it's constantly changing, so I try my hardest to make sure that you all are up to date on everything. So if this is new information for you, I apologize if it hasn't gotten to you yet, but I'm working on it. So, and you guys, you're doing a great job with your strategic plan. I'm the secretary of the New Hampshire Breastfeeding Task Force, and this all is such daunting. It's exciting, but it's daunting. And we just had a 4-hour Zoom meeting last Thursday, the New Hampshire Breastfeeding Task Force, because we just that was our yearly look at our strategic plan. So hang in there. It looks great, you guys. And I know, Kara, you talk with Joyce and, with all of this stuff. And we have some really exciting stuff going on with legislation, just like you guys do. So our legislation now with workplaces in the House. So we're excited. So all of this stuff is really good. So I'm really so proud of you guys. It's a really exciting time for all of you. So congratulations on that.
Thank you so much. I've only been on the board 2 years now, and it was like overwhelming, and I'm so excited that it's done and it looks pretty.
Yeah, it does. It looks pretty. It sounds great. But it is, it's daunting, and we all just, look, and, we're also a 501c, up over here in New Hampshire, and it's a lot of work, but, now we're getting our groove on. We've been doing it for a few years now. So I will tell you, we remember where we were with how you guys are. But we all were just talking, we're like, wow, yep, check. We went through our goals. We went through the actions, and we're like, done. Oh my gosh, we are just like moving right along here. So it does get better. You guys are in the thick of it right now, but anything you guys need, or, any help that you need, or any guidance or anything, your good old friends in New Hampshire are more than willing. So And I'm the secretary, so I have all the documents, so just let me know.
Thank you.
Thank you so much.
Yeah. I know it's exciting to be where we are, but we still have the work to do. So
I know.
you know, I think a lot of people who have been coming to our meetings have been hearing us talk about we're working on it. And I think a lot of people want to do something and know what they're doing. Like, what can I do? Well, we have lots of ideas for how you can help. We won't be able to do this on our own. So
yeah. And right now you guys are kind of putting those finishing touches on your goals and your actions. And then it's the next kind of daunting and overwhelming task to look at those and say, how are we going to execute the actions? And that's kind of what, you know, we just spent 4 hours reviewing, you know, and some of them will go quick and some of them, just like you guys, were like, oh my goodness, we have been looking at that action and that goal for years now. You know, so, but you get there, you guys are going to do it. You're the state of Maine. You're amazing. So you're going to do amazing things.
Thank you so much. It's so nice to have you to ask questions to and all that for your coalition.
Absolutely. Anytime, you know, Joyce, and Joyce is, she's accomplished so much, you know, as our chair in New Hampshire, and she's a great resource and always willing to help, you know, with this kind of stuff. So please don't hesitate to reach out to any of us on the board. Exciting.
Thanks, Holly. Kara, did we talk about the storytelling event? It was supposed to be May last year, and then it was going to be May this year, but we have moved it to May 2020. I believe it's May 7th, 2020. So
2022.
Yes, sorry.
Yeah.
Going backwards. 2022. So yeah, it's still happening in the future. And then but World Breastfeeding Week last year was amazing. So, you know, we'll do something like that again this year in August. All right, anybody else have anything they want to talk about?
So I have something. We had started back in 2020, the beginning of 2020, we started, it was a mom's group at the time, but now we'll do a parents group to be more inclusive. Obviously we started it in person and then the pandemic happened. So I talked with the lady at the hospital where we were doing it, and we kind of decided to hold off for a while just to see what was going to happen. And now it's kind of clear that we should probably think about doing it via Zoom. So I was just wondering if anyone knows of any like parent support groups that are going on via Zoom, or if anyone has any ideas to kind of get that out there. We're thinking probably what we'll do is put it on our Facebook, which is Wick, Hancock, and Washington counties. And then as people say they're interested, we'll get their emails and send them the link. So we're not putting the link on the Facebook itself. But yeah, I just was wondering if anyone knows of any groups and how they are running, and if anyone has any ideas or suggestions. We had been doing it on a Monday, mid-morning, every Monday. So I think that's kind of what we'll go with, and hopefully at some point soon we can have it in person again. But I think having that resource is pretty important for parents.
Hi, Savannah. It's Rihanna from the Bangor WIC. So that's awesome. So we do a newborn nutrition class that we just started last month, and definitely doing the social media advertising. That's been one of our, it's like so hard because of COVID and being so remote and everything. But that's how we've kind of tackled it, is a lot of advertising. Like we have a newsletter too that we send out. But Mitchell, our peer counselor, she's been really involved with actually, she keeps a lot of data with like pregnant moms at like certain gestations and everything. And she will actually contact them one-on-one to see, like a phone call, and be like, hey, we're holding this class. Like, do you want to participate? And that's just kind of what we've been doing with that. But that's just a couple tidbits about that, but that's awesome. I really like that idea.
Yeah, I'll keep you updated for sure. We've been working with Northern Light Maine Coast. I know some of the nurses pretty well, so I worked with them to get it started. Just out of curiosity, how is like attendance with Mitchell's groups?
Yeah, so we just did it. We held two, and we were trying to see where the timings would fit most people. So we did one in the morning and one in the night. And the one at night, like after work hours, because we do a night clinic here, that one was the most popular. And I say popular in quotations because we had 2 participants, which was not a lot. Our maximum was 10 people because we are keeping it pretty condensed. But I mean, we're also having, we have incentives too for it. So we have like things that we'll send them, like education materials, and also little gifts that we'll send them if they complete the class and everything. So we had 2 that completed everything and got the incentives, but yeah, we're hoping we're not holding it again until May because we're going to try to leave a little bit more time for people to get to know about the class since we're so remote, and hopefully we'll get more participation over the next 2 months.
Sure. Yeah, I had found it. So when we started the group in person, it took a little bit of time to kind of get some momentum going, and it seemed like we were just kind of getting people to consistently show up, and then
yeah, and it's definitely harder with like everything going on and having to advertise over social media. So we've been trying to advertise our social media a lot more too, to like try to get to more people. So it's just a work in progress for sure.
Yeah, great. Thank you.
So Ben, I have a couple of other thoughts. I'm Nicole. I run a virtual group for Maine Mother and Company in Brunswick. And after, just want to tell you to hang in there. So what we found was it took a few months of, so at the beginning of the pandemic, we had some parents who had been coming consistently to our in-person groups who kind of like hung in there when we changed them to virtual. And then their babies kind of like got past the stage, you know, they were mobile, they were all over the place, it wasn't a good fit anymore. And then there was a real lull where a few people got some one-on-one doula consults with me, and that like doesn't really incentivize them to come back because they, you know, that was nice for them, but that's not what they were looking for. They're looking for connection. But we found like 3 months in, having it be free, which I assume you're going to do at WIC, and then having connections with OBs and midwives in the area who can refer pregnant and postpartum patients and let them know about the group. That was really key to us when we first launched our in-person groups. And I'd imagine for you it would be the same, launching a virtual group. So you're kind of building a pipeline of other folks who are letting people know. Hang in there, be patient. That's what I would say. Because now we have a great group going with a consistent group of like 6 to 8 parents who are coming, and it's wonderful. But there were 3 months where it was not.
Yeah.
But I think having realistic expectations would have helped us.
Yeah, definitely. Thank you. I appreciate that for sure.
And I can speak to Maine Med's group as well. I'll put in the chat box the link to Maine Med's groups that are open to anyone, really. I know Ellen is here on the call too. She could speak to the parent circle group. The breastfeeding group, you know, attendance has gone up and down. It always rides waves. I feel like the lull has been more recently, though it's starting to pick up with 3 or 4 moms again. In person, we would usually have between 6 and 8, and that's how it started when the pandemic started, but then it kind of has had its lull again. So we'll see. I expect it to go back up again here too. I think that's great advice to hang in there and have know that it's kind of like a what's the term I'm looking for? Like a ball that needs to roll for a bit to collect more folks coming. I'm not explaining that well, but I think you know what I mean.
I can speak to the, oh, sorry.
No, go ahead.
Okay, the New Parents Circle, which is a Maine Med New Parents group as well too. It used to be known as the Mothering Circle. Just what Kara said, you know, it goes up and down, but I think one of the things is that accessibility. So what we have at Maine Med is that the people who want to attend need to register online through our childbirth ed website, and then they will receive an email. And I understand that they don't want the link to be out there in public, you know, confidentiality and privacy. But I think it's a little bit of a barrier that, you know, it's just like, oh my gosh, so now I want to join this group and now I have to go in and register and all of that. But also I'm on the board of the Maternal Health Alliance of Maine. And we offer a Saturday morning support group that is free as well. It's run by a trained volunteer facilitator, Hannah Lamprey, and they have pretty good turnout. But it's similar. You need to go to the website, and I'll type that in just in case anybody's interested in sending someone, and you know, and enter their email, and then they'll get the link to join as well too. I'll send that information, but it's definitely different than in person. But a lot of the moms like it because they're just, hey, I just got up, I'm on my couch, or my baby just got up from a nap and I joined 20 minutes late, and that's totally fine. So.
Yeah, the only thing I was going to add is that it might be good to figure out what your public school, like when your public schools, like at least here, Wednesdays are never days that are very full for, I think, most public school kids in Southern Maine. So like that may be not a great day to do it if, you know, parents may have older children that are in school. You know, they may prefer a day when, or a time when, you know, their kids are in school. So they're not homeschooling as many of us are doing. So that was just like something I thought of, but maybe your Monday morning time is an excellent one for that reason. But I like the idea of the evening too. That seems like a great thing when like parenting duties may be different or could shift to a different parent perhaps.
Yeah, thank you, Sarah. I appreciate that because I honestly wouldn't have thought of that. So thank you. That is a really good thing to think about.
Hi, Petra Kaur from La Leche League. So La Leche League of Maine and New Hampshire does 2 Zoom meetings a month, and one is in the morning and one is in the evening. So that way parents have kind of 2 different times that they can pick from. And I lead a meeting for one of the groups that I'm involved with right on Facebook for those parents who might not have Zoom, or, you know, their internet connection isn't all that great. And they'll be 2 hours long, and every 10 minutes we post like a question or a prompt, and then people just comment right on that post their answers to those questions or their comments. So I've found that I get really good attendance for those Facebook meetings just because it's such an easy platform to use for a lot of people. So those are just some things. And I think parents really like having the option of choosing morning or evening, but I know that might not be feasible for your group to have 2 meetings a month at different times. But yeah, it's just something to think about, definitely.
Yeah, thank you. This is all really wonderful feedback. So thank you, everyone. I appreciate it. And I think, so we do have in Hancock and Washington County, I'm sure some of you know this, but we have 2 peer counselors now. So, so yeah, I think offering, you know, the 2 different times could be a possibility that we can think about and work with. So great. Thank you, everyone.
It would be great if someone could do like a 2 a.m. one when you get up to do a feed and, you know, there's a lot of loneliness happening. So
you can run that, Amanda.
well, anybody else have anything?
I'm Liana from Maine Families Program at the Opportunity Alliance. And since you asked about things people are excited about, I was excited to see the outreach to BIPOC communities in terms of training and just to do more outreach. I think for us at this point, we're about 40% of our families that we're serving are families of color and immigrants. And so we're always looking for resources about how to support around breastfeeding, and have come to realize just how cultural messaging needs to be around breastfeeding and pumping. And so I'm just excited to see that that work is moving forward and that it's being prioritized. So thank you.
Great, thank you for the feedback. Anybody else have anything to share? I also just want to point out that Nicole is wearing her boob earrings and they're amazing.
They're made by a local Maine mom, actually. I'm gonna put
in the chat.
Same in the chat box because she is wonderful, and I think everyone should have these boobs.
If there's any audience to share the main boob artist to, this is the audience. So hopefully you all had access to that Google Doc. You can see some resources. The resources that I have in there now are some educational resources related to Asian Americans advancing justice. There's ACLUmaine.org, how to respond to coronavirus racism in particular, Coalition to Stop Gun Violence. So some bunch of different resources, also bystander intervention trainings if you're interested in that. And then there are a number of different breastfeeding conferences coming up. So the Cheer Virtual Breastfeeding Conference looks really good. The MSBC conference is coming up in June as well. And PQI, I don't know, Amanda, if you can speak a little bit to the Speak Up Champions training, the implicit and explicit racial bias education that's in May. Do you know much about that, or is there anything you want to share about that?
Yeah, can you hear me? I feel like my internet is getting choppy.
It's a little choppy, but go for it. I think it'll be okay.
Okay. Yeah, you put me on the spot. I do the back end of all of those conferences, so yes, I know a lot about them. Can you still hear me?
Mostly. Oh, I don't know. That's okay. That's all right. If you want to add anything to the chat that's not already here, but it's in that Google Doc that I just sent again. Speak Up Champions webinar. The BEST conference is coming up.
I'll put some things in the chat.
Okay. BEST conference is coming up in May. There's also the perinatal outreach breastfeeding webinar series that I do every other month. May 5th, it'll be on cue-based feeding. And then I just put in some resources that were shared in the group here today. I see a question from Abigail. Are there any networking opportunities outside of these meetings for newbies like me? So networking specific to what, Abigail, if you don't mind? You can unmute too if you want to ask that.
I'll try. My internet's been going in and out. Just connecting. I moved here last year, and since everything is mostly virtual, it's hard to connect with people in general, but also people who have a passion for lactation. So I just didn't know if there was any sort of networking opportunities out there, either virtual, or socially distanced or something like that. Because it is kind of isolating, especially because I work remotely. So all my colleagues are not in the state.
Anything else that anyone knows about? I know, is anyone here a doula or from the Doulas in Maine group who might be able to speak to, are there any doula networking events that are happening?
There used to be, but I don't think, I think Natalie left the call, I think. Natalie Grammer and Jody Finney of Maine Doulas were running some networking events, but I honestly don't think there's been anything since COVID. That's definitely a Facebook group worth joining, even if you're not a doula, Abigail, because there's a lot of doulas who are lactation professionals as well. And, you know, you're definitely going to probably connect with some of your people there. I'm in South Portland. I just private messaged you. I'm happy to go for a walk sometime. I don't know of any, like, it's kind of sad that nothing's popping up.
No, I appreciate that. No, I just thought I would throw it out there and ask. And, you know, my passion and background is primarily in training program, establishing like lactation consultant training programs. So if anyone has an interest in that, I'd be happy to, you know, connect with people and talk that kind of geek language, so to speak. Or if there's a, you know, any interest within the state of Maine of establishing any sort of lactation consultant training programs, let me know.
Yes, there is. And yes, Abigail, you and me, you should connect with me and Paula Norcott about this because we've been scheming about some things. So if you put your email in the chat box again, I'll reach out to you.
Yeah, I just, you know, my mind is churning after just attending this one meeting and seeing how so many people are here. I'm like, you know, the collaboration, I think it's like almost here. I can see that kind of gear stuff working in the background already. So very neat.
Yay.
Awesome.
Does anybody know, Kara, do you know if the Best Connection is offering a fall conference too?
I don't know.
The only reason I mentioned that, Abigail, is that if it were to be in person, that's the place to network with people. It's harder when it's online, but yeah, so the great conference.
Probably last call. We can spend a couple more minutes on any other shares or questions, and then we can wrap up with sharing what's happening the rest of the year. I think we heard from Maine Families, we heard from Leche League, we heard from WIC, we've heard from a hospital representative or lactation consultant, educators. All right, well, know that you can always use the chat box. You can always add anything to that Google Doc at any point. If you have any trouble getting that, then let me know. And I think we'll move on with, I'm going to share my screen again. Let's see how this goes. And hold on a second. Sometimes my mouse wants to do what I want it to do, and sometimes it doesn't. Okay. All right, glad you're here, Amy. Thank you. Okay, why is that? One moment. There we go. Okay, can you all see the meetings? All right, so the next meeting, June 3rd, we will have Ashley Olin, who was here earlier in the meeting today. She had to drop off for another meeting. She's going to speak about substance use and breastfeeding, and specifically about the Maine maternal opioid model and the plan of safe care. So there's a lot we can learn about that, and I'm guessing some of you work with folks who this might apply to. So please join us on June 3rd. And again, these meetings are from 1 to 3 p.m., as you know. August 5th will be the meeting after that, and we will have some sort of World Breastfeeding Week celebration and some sort of theme related to that. October 7th, we will have Brooke, who we heard from earlier, give us a brief advocacy session. And she's going to give us an overview of Advocacy 101. So what are the state of affairs regarding laws supporting breastfeeding and workplace in the public and how to advocate? What else can we understand to do this? And what else could we do going forward? And then in December, Paula Norcott, who Nicole just mentioned, she's a lactation consultant and a childbirth educator and a doula. She's going to speak about birth and breastfeeding. So that's a big topic, right? We know that the birth experience can certainly impact the breastfeeding experience. So she's going to speak about that. And pretty soon we'll start planning for our 2022 meetings. So we are always open to hearing what you would like to hear more about. Who would you like to come speak to in the meetings, and what topics are you looking for more information on? And again, I would love to hear, so that's basically all I have to share for slides. I think the last slide is just a thank you for joining us. But I want to just give you another opportunity to share your thoughts on the strategic plan. So either in the chat box, or you're welcome to email. If you have any specific questions, then please feel free to just email us. But if you have any questions, I know one question was sent to me. I'm just going to ask it, or I'm going to mention it now. Someone had asked or had noticed that there wasn't anything related to the Baby Friendly Hospital Initiative. And that was a great question, and that didn't quite make it. So there's so many different things that we could add to our strategic plan, and we're already probably overshooting a little bit with what we have in here. But I think we also are looking at what work is already being done elsewhere too. And I think many of you know that another hat that I wear is with the perinatal outreach program. And that is very much hospital supportive, hospital breastfeeding education related anyway. It's not baby friendly specific necessarily. We had been working on something called 6 for Me, which was 6 of the 10 steps. And that's still work that can be done. But I think that was a great question. So I'm looking for any other questions like that, like what didn't you see, or what are you excited about in particular? And I guess I could go back and share in our last 6 minutes, go back to the first strategic plan slide if you want something to kind of jog your memory. Any other thoughts or questions about it? Oops.
So this is Sarah. So when I'm looking at the leftmost connect, it just reminds me of something that someone here mentioned about wanting to connect more informally. And that could be an interesting way to kind of reach that goal on the left of connection, is to maybe sponsor some more informal, like very informal get-togethers where lots of fun connections could be made. So
like that, yeah.
Yeah.
Well, this will be available on our website once we have it a little more finalized. Once you're still welcome to send feedback over these next few weeks before we really tie it up with a bit of a bow. And we'll be working on action plans or work plans for each of these as we go too. So there are lots of opportunities for feedback and thoughts and suggestions, and lots of opportunities to volunteer to help implement these as well. So know that you can always email us. I don't know if our email has been dropped into the chat box yet, mainbreastfeeds@gmail.com, but know that you can always reach us. And thank you so much for being here today and for sticking through the full 2 hours. And we hope, oh, Brooke, I see you've raised your hand.
I just had one thing I wanted to share, that Governor Janet Mills just announced that all adults 16 and up will be eligible to sign up for the vaccine starting on next Wednesday.
Yeah.
So go get your appointments.
Woohoo!
That's so exciting.
That's really good news. Thank you for sharing that, Brooke. That's such a great way to end the meeting on such a note of optimism.
Yay.
Oh, can I put in a plug for World Breastfeeding Week committee? If anyone is interested, you can email Kara. We would love a couple of people not on the board, or at least one person who's not on the board, to join us. That's all.
Thank you, Nicole. Awesome. All right. I think we're going to call it. Thank you all. Have a really great rest of your Thursday, great weekend. Happy April Fool's Day. Best wishes as you continue the day. Hopefully you don't succumb to too many jokes. Bad jokes anyway. All right. Have a good day.
Great. Thanks, Kara. Bye, everybody.
Amanda, I think you offered to stay on. That might be helpful for a second. Thanks. Bye, everyone. So I'm looking at your text messages now. So
You can also move, you can move people to the waiting room.
yes. Well, I'm going to stop.